I'm on, but well, yeah, like it does do speaker, but okay. I can't tell. Like it says, did it beep or anything? Oh, it says you're connected to audio. Okay, we'll see. No, maybe bring the leader in my speaker. Okay. Yeah. I don't know. Oh, did you hear that? Just a doo-doo. Oh, something's happening.
Hi everyone, how are you? Hello.
I have echo.
Yes, I do hear a little bit of an echo. So for the first few minutes, we're going to be muting you guys. And when I ask you to share out, we can unmute you, okay?
Okay.
Okay. Attendance. Okay, so welcome to our first official Hallways to Health Learning Collaborative call. Thank you guys so much for being on. And I see I'm going to just look at the attendance list. So it looks like from Milwaukee, Rachel Bowen is on. From San Fernando.
Christine.
Oh, and Christine. Hi, Christine. From
Hello.
San Fernando, Aurora is on.
And Margarita.
And Margarita. Great. From California, Molly is on. From St. Francis, Pat is on. And and from Turner, Sarah, you ended up being able to make it.
Yes. The only one I can't come to is in March.
Ah, okay. Great. And Monica is on from Georgia. And Mandy is on from Washington. So as others join, we will note that. Okay. So Tiara, if you could click to the next slide. Actually, I think we are wonderful. So I just wanted to review our agenda for today. Thank you for helping us take attendance. And what we're going to do after that is just review the Hallways Health sort of framework, going through the concept map, which we talked about in the beginning of our time. And then we will be talking about evaluation, and so you see how everything is linked together. Then we'll be moving to the School Employee Wellness Action Plan and providing successes and challenges. And then to the Student Wellness Action Plan, successes and challenges. And then finally we'll wrap up with project update. So, I'm muted. So I posted something on Basecamp yesterday, and I just wanted to ask all of you, and so we'll unmute you after I ask the question. There was a great article in the New Yorker about resilience, and I think when we talk about our work here, what we were talking about in terms of needs assessments is often a negative connotation about what risk factors our students are facing and what type of negative outset that sets them up for. So just to begin our first Learning Collaborative call in a positive manner, I want to pose this question. I don't know if any of you had the opportunity to read the article, but absolutely you should. So the question is really just if you're thinking about your interactions with students at your school, teachers at your school, administrators at your school, if you have any examples of any children whose backgrounds had initially raised red flags, kids who seemed like they might become problem children, and who had instead become surprisingly a source of pride. Can you identify any children who were stressed, who are really making it in your school? So maybe we can just get one or two folks to share out about any examples they have of students who have shown real resiliency.
Alexis? Can somebody ask? No.
So just want to let you know, you guys are unmuted. So if one or two sites could share out about students that you have seen who have really demonstrated resilience and strength in the school, we would love you to share out.
This is Rachel. So one of my Youth Advisory Council members is this girl, Brittany, who I have actually only known her because I've only been in this position, in this capacity, since September, but she's part of the Youth Advisory Council, which is just sort of the latest, her latest involvement within the school, and she recently told her story and opened up about her story and becoming involved with the School-Based Health Center at MHS through struggling with anxiety and depression and not really knowing how to handle it, and being, coming from a quote-unquote privileged family or a family with access to resources and food and whatnot, and feeling like she was struggling with, how to handle why she was feeling sad and didn't want her parents to, feel like she wasn't grateful for what the things she was given, and realizing that she was struggling with, anxiety and depression and not being able to concentrate in class. And she was referred to the School-Based Health Center to go through, to access some of our behavioral health services here, and through that she sort of been able to get referred to a long-term counselor, and she's really turned around sort of her own ability to participate in school, and then has since joined things like the Youth Advisory Council and other student groups, and that happened to her freshman year, and she's now a junior. So that's a quick example.
That's an awesome example. Thank you so much for sharing, and obviously that She's taken on leadership roles and being involved in Youth Advisory Council, and has not only shown resilience, but has shown that she can be a leader. So thank you so much for sharing. Any other sites? Okay, we'll put it to a thought question, and then I'll encourage you to answer that question that had already been posted on Basecamp, and definitely to read the article. But thanks for starting off on the right foot. So Tiara, if you could advance to the next slide, that would be great. Okay, so this is a document we saw at the beginning of our Hallways to Health work, and it's a few months ago. So it was before we participated in the capacity building training program, and it has changed a little bit. But I just wanted to remind you that we are conducting training and technical assistance, and through that training and technical assistance, we are completing needs assessments that identify the priorities of students and school staff. That the needs assessments will drive the development and implementation of new approaches, and identify opportunities to strengthen relationships with stakeholders and funders. And we will be utilizing the data, as you've already been doing in your action plans, to drive your action plans, and eventually to drive sustainable billing and business practices as well. As you see in the action plan template, we're asking to design interventions that occur at the school level and at the systems level. And ultimately, these will be leading to policy and system change, which you see kind of as that light blue box. And we believe that this will contribute to being able to have SBHC sustain their population health work, and that'll be assessed through things like partnerships, systems, coordination, ability to code and bill, improved school employee wellness, assessed through reach and impact, the collaboration in the school integration, and improved social, emotional, and physical health for students. Also assessed through reach, impact, collaboration, school integration. And then ultimately the vision and impact are that we're going to be able to enable and sustain population health work, and that you guys will continue to have a role in that. And for the students, that the students are healthy and achieving their full academic potential. So with that in mind, the concept map is a tool to show where our overall project is going. The action plan will be used as a tool to aggregate data, select your priorities, identify your approaches, and ultimately select and detail the approaches as well as the measures which will get to school-wide policy and systems change. The quarterly reports will be used as a way to check in individually and report on your progress. And the Learning Collaborative calls, just like this one, will be used as an opportunity cohort-wide to share out challenges and successes, and to do some group troubleshooting, because you all are in the field and have done wonderful work, and I'm at a desk at Washington, D.C., and I'm not situated in the School-Based Health Center. So these calls will be really rich for that. So in the end, hopefully that will be able to drive our evaluation. So if we flip back to the concept map for 1 second, you can see that policy and system change is a big piece of the work that we're doing. And then if you go back to the evaluation framework, so the types of things that we're going to be asking you on the evaluation at the end of the school year include things about policy and system change. So even in your action plan, when you're getting to what you're going to do in the clinic, what you're going to do in the school, it should all be kind of nested within how that fits into systems and policy changes. So some of that includes priority setting, policy formulation, what level of system change will you have achieved, stakeholder engagement. Who will you have engaged? Who do you need to engage? And where are there opportunities for further engagement? Developing the systems change. So those types of items include what activities have you undertaken to develop the systems change? When we think about adoption and enactment of the systems and policy change, we'll say, was there a policy or a system change that happened? Who were the people who were involved in it? What challenges prevented it from happening? So many of the things that you are already including in your action plans, reporting in your quarterly reports, and I'm going to be discussing on these calls. I just wanted to provide an overall revisit and framework. And when we ask about impact, we're going to talk about what are the positive outcomes resulting from the system change, who benefited and how many, and what were the unintended consequences of the change. When we talk about implementation and enforcement, we're going to talk about at what level were you able to implement your systems change. Was it at a classroom level, at a grade level, school-wide, district-wide? And it seems like many of you are already on the path to doing this in a variety of ways. And so I just want to actually take a minute to ask out, even though we're in the early phases of year 2 and we're just beginning our action plan, I want to take an opportunity to ask if you have examples of policy change that have already happened. What types of policy changes might already have happened? What types of policies have you looked at in your environmental scans? So I'll just we'll unmute you and allow you to answer those questions.
I guess I'll chime in. This is Mizan Alkebulan from Oakland Roosevelt Health Center. One of the policy changes that we've been able to implement over the last couple of years is doing a school-wide student and staff wellness survey as part of our work. While it's not RAPS and it's not the tool that's been devised by there, it's definitely been a useful tool for us to kind of look at an environmental awareness around how students are self-reporting on different levels around safety and school connectedness, and other measures around like diet recall and kind of basic nutrition and physical activity kind of pieces that help to inform some of the work. And it's been done within collaboration with our wellness committee that's on the school site, the administrators, our restorative justice coordinator, our PBIS committee, and kind of a collaboration of those. So those are things that have been kind of a policy shift for the school in itself to be able to consistently do this wellness scan of our students and our staff 3 times throughout the year so that we can look at the data and see how the trends change throughout the year based upon the work that we do.
Yeah, awesome. And those surveys, it sounds like, really have driven the work that you're doing, and it sounds like you guys are using them, the results of those, and constantly using it for feedback 3 times throughout the year. That's amazing to be able to survey your students. Wow. Thank you so much for sharing, Mizan. Any other types of policy changes which have already happened at any of your sites, or policy change that you guys are working toward?
This is Gabby from San Diego Rice School. We've also implemented a survey to the teachers and the staff overall at the school, and we got some feedback as some of the things that they would like to see done so that they could get some stress relievers and some of the things that they would like to see in the school so that they can have more, like, for example, if they didn't bring their lunch, maybe something that they can have easy access, like a vending machine or something that where they can get something fast but it's still healthy. So that was, we got a lot of feedback and things that they wanted to see to be implemented. We also, they welcome very much the newsletters for tips and some healthy eating habits as well. And as I mentioned, some of the stress release that they would like to see in times where they're doing a lot of testing and things like that. So that was kind of, we got really nice feedback from the teachers as well as some of the staff that works there and the principal So that was really nice.
Awesome. Thank you so much for sharing. Yeah, and I'm really glad that we'll talk a little bit about the staff wellness survey and being used to guide your action plans. But great example. Yeah, thank you so much, guys. So you're already on the path to system change, getting administrative buy-in to support your initiatives. And sometimes it's just about, I was working with some sites yesterday and the day before about recognizing that a policy change had happened because sometimes they just seem like they're conversations and meetings and agreements of things that are going to happen without recognizing that it is a policy change and thinking about the potential impact of that change. So awesome. Okay, moving forward. Okay, so with that being said, the major two things that one of the major things that you guys have been asked to do and to submit in the last few weeks has been the School Employee Wellness Action Plan. And I just wanted to give an opportunity to ask what you learned through this process, any examples of how you've used the tool, who you might have involved in the development of the tool, and ask if your priorities aligned with those of your stakeholders, if you involved your stakeholders in the process. And I know that there are some specific examples of wellness action plans which we'd really like to highlight because we thought that they had a really great level of detail. So does anyone want to share a success or a challenge that they've had with completing the wellness action plan?
This is Pat. Can you hear me?
Yes.
Okay. The wellness plan that we did as part of this whole process was really interesting to me, and one of the things that highlighted, even though we are a very small school with a limited number of staff, there is a lot of turnover because of the nature of the school. They accept many teachers from Teach for America and things like that, which come to St. Francis and teach for a couple years. While they're there, they get their masters that are very substantial, very small, per $25 per credit hour. So generally they stay for a couple years and maybe even a year after that. But that is one of the things that explains the high turnover. And from the wellness survey, what I found that was needed was some orientation to the wellness facilities that are already in place, as well as what people want to have. For example, some of the people, particularly if they were part-time, didn't even know there was a faculty lounge, didn't know that there were that the vending machines had been changed mostly because of Hallways to Health, to healthier options that they could have. So there really was a lack of knowledge of new employees, and even those that have been there a couple of years, about what was really there. So that really was a great pointer in the direction of what needed to be done, which is kind of an orientation to these activities that we want the teachers and other staff to be involved in.
Awesome, yeah, and Pat, that's actually the example that one of the examples that I was thinking about, because creating an orientation manual for new folks who are going to be working in the school to talk about the wellness initiatives and whatnot is absolutely a policy win. So even though it didn't seem like that was, and that came out of conducting the survey, that the idea to create that type of orientation manual is really wonderful. Does anyone else have something to talk to new employees about the employee wellness items that are already happening at your school? Okay. All right, so I also actually want to share, Pat, while you were sharing out, I want to bring up St. Francis's school employee wellness plan. And Pat, I just wanted to ask you to share just quickly about how you developed the timeline and kind of like the level of detail that you put in there.
Well, actually, for the responsible party, it was pretty easy because we only have 2 staff, and then the mental health staff. So primarily, it's going to be clinic staff that are going to be involved. I'm trying to. So I just had my eyes checked. I'm trying to see this. Some people did. I mean, some of this came from the wellness survey, or implications from the survey, and patients, teacher, staff had requested individual nutrition plans, for example. So we have set up an opportunity for people who want them to sign up for them. We'll need to schedule individual appointments for them when either on their planning time or after school. The Biggest Loser contest, we announced it in the last faculty staff meeting. People were really interested in it and were willing to put in a few dollars, and then the Biggest Loser gets the pot at the end. We do the initial weigh-ins, and we do the weekly weigh-ins at the clinic. Can you move that down for me a little bit? Thank you. Yoga, one of the issues, we tried yoga. We tried to have it during the yoga person come during the entire lunch periods when staff and teachers may be available. It was not particularly successful. There were some days no one came. Then there were changes because of snow days and shortened days because of teachers conference. But essentially, even when there weren't any of those issues, we only had 1 or 2 people. So actually, one of the staff had suggested having the yoga person come to the next development day and spend an hour with the staff teaching them exercises, stretches, stress reducers that they could use in their classroom while they're at the desk for the non-teaching staff. So they were very responsive to this. And this will be at the development day in March.
Great. So it sounds like, Pat, what you did to develop the timeline was some of the things that you already had in place in previous years. You kind of knew what steps were going to go into it and made specific deadlines for those. If anyone was going to start a new project, they might have ranges of dates that they might want to conduct. I kind of want to encourage you guys to have to break things out into chunks. So for instance, Biggest Loser here wasn't just, we will have the Biggest Loser competition. It was about the marketing of the competition. It was about the involving of the stakeholders throughout the competition. Schedule. So I would encourage you, for planning purposes, especially for a new program, to use this timeline to break up the steps and really, it may not be as useful for our benefit to have every single step, but for your own benefits, to make sure that you kind of dotted all I's and cross all T's, I would suggest that all the sites kind of break it out into chunks like that. So thank you so much for sharing on that, Pat. One quick second while I hop back down to my PowerPoint. And I'll okay. And if anyone else had school employee wellness action plan successes, Mandy, I know that you're on the call. I'd love to be able to have you talk about how you did your action plan and how that process went, and you know, how you decided to break it out by different aims and to show each aim corresponded with each approach.
Sure. Can you hear me?
Yeah. And I have your action plan, so I could pull it up as well if you would like me to.
Great. Okay. So what I did is I used my background is in corporate wellness, and I looked at what we could do with the schools, and what I found, I whittled it down to 3 things. One is stress management. So we know that school employees tend to be more stressed. It's just a difficult job. I've done it, and that's why I'm happy to be in this role now. So I broke it down into stress management, nutrition, because a lot of people, all of our schools, I would be willing to guess, have unhealthy options within walking distance. And then what I have them focusing on is there are actually healthy options in our Seattle schools. You just have to ask for them. So changing the supply and demand and working out a deal so that our school employees can, if they forget their lunch, ideally they pack a healthy lunch, but if they forget it, there are reasonably priced healthy options at our schools that I think a lot of the staff don't know about based on the survey that we sent out. And then the third is physical activity. So even though they're up and moving around the classroom, trying to find a way to get them more physical activity, and we proposed that we work with the PTSA to fund, say, $1 per lap when they walk around the school. That would go towards staff wellness.
And Mandy, I thought it was awesome that you color-coded your aims, and then if I scroll down, everyone see this? Everyone see this? Oh, 1 second. Those are the comments. Sorry. Mandy did the same thing down here. So she put in school board members, and every time aim 2 applied, she put it in, and you saw that it was color-coded, so it went all the way through. So you could tie back all of the aim 2s with the orange, so you wouldn't need to involve, I'm guessing in 2, I would have to scroll back up to the top, was about around the food service, which we were just talking about. So food service staff has to be involved, the vendors have to be involved, the union leaders have to be involved, etc. And then you did the same thing here, in which you broke out the aims and the approaches into the colored tabs as well. Just see quickly, we wrote some comments because we will be sharing feedback with each of you on your school employee wellness action plan. So color coding might be a great thing to do to help you kind of, talk about, identify this aim goes with this approach, and then we're going to measure it in this way. Additionally, we have another tool that we have developed which can help assist in that process as well. So I know this is a little bit challenging to see, but essentially we've developed this implementation tool which breaks out, after we started to receive some of those employee wellness action plans, we saw that it could be a little bit clearer to, again, put more detail into the timeline and denote a little bit more clearly who the responsible party is and what are each of the incremental steps that have to happen. So that's kind of the top part, and you see an example listed there. So one says, that's for the staff break room. Then another responsible party says it's going to be John Smith, this particular individual. And okay, so we would give the particular step for that, just like Pat did. And then any notes would be about, okay, I must prepare the information about the cost, ideas, etc. And then the second piece of the implementation tool breaks out the stakeholder chart a little bit more. So let's say we were talking about Mandy's approaches beforehand, and she had 2 aims. So for each of her aims, maybe she had 3 possible approaches. So let's say her first approach was, Mandy, what was one of your approaches that you were just talking about? Around nutrition. Oh, sorry, I muted you. That's fine. So Mandy's approach around school nutrition for the employees was, again, remind me?
Yep, so there are healthy options in the cafeteria and making the staff more aware of the healthy and affordable options.
Awesome. So that might be your first approach. And so what you would say is who needs to be aware? Maybe the school board needs to be aware of that specific approach. Maybe they need to give approval, but maybe they don't need to help implement. So you would put X in the appropriate column for those stakeholders. Okay? So that tool is available, and we can provide that, and we will provide that on Basecamp. And just one quick second while we just jump to the chat box. I see that there's a question about presenter. So I'm the only person who's going to be the presenter right now. And if you have something you want to share, we can share that out at the end of the presentation. Okay. So moving forward, so I can post this implementation tool on Basecamp, and I see that some of you have already started to use it, and it helps give a little bit more detail to your action plan. So thank you for that. Okay. So in talking about the student action plans, I know that many of you are you're kind of in different places around the action plans, given that some of the sites are conducting the RAPS needs assessment. In fact, 2 of our sites are conducting the RAPS needs assessment in their schools today, so they are unable to join us on the call. And that the sites that are doing the RAPS needs assessment have a different kind of deadline for the school student action plans.
Excuse me, this is Century High School, and we are doing our needs assessment today, but I am on the call with Dr. Roberts.
Oh, wonderful. Okay, great. Hi, Dr. Roberts. Thanks.
Hi.
Yep. In touch at the beginning. One quick second. Let's just mark that down. Okay, okay. Great. So anyway, I wanted to just ask out again, what successes have you had with the Student Wellness Action Plan? What challenges have you had? Have you engaged any stakeholders in this process? So for instance, I know at Northwood you're in constant conversation with your administrator and you're trying to develop your action plan. You hope to develop your action plan based on the priorities that your administrators have set. So can anyone share out what it's been like if you have already completed an action plan or you're in the process of doing your environmental scan, like what has gone well and what has been the challenge so far?
Can you hear me? Hear Jordana?
Yes, we can hear you. Hi, Kay.
What?
Okay, I would say it's sort of overstating it to say we're in constant contact with our administrator. What I would say is after 2 years of working on it, we got a meeting and got her priorities. In our case is attendance, because Northwood has the highest absentee rate in Montgomery County, which this year is 19.9%, so 20% for all intents and purposes. You know, I have to say it's been a little, how can I say it? It's been some creativeness to pull this in with health and wellness. This we've been working on for a couple of years, but we are managing, and we've been doing, we aren't permitted by the county to do grabs. So we've been relying on other sources of information, and we are meeting again the 25th, not with the principal, her representative, and with a lot of stakeholders, counseling department, the pupil personnel worker, some outreach people from Montgomery County, school system. So we're trying to dig at some of the underlying causes of that absenteeism, and we've been talking to some of the kids, there are a lot of different reasons for that absenteeism, some of them having to do with health and wellness, some of them having to do with poverty, recent immigration. And I know you've probably seen our plan that went, I don't know if you have seen our plan that went in this week, where we've in all our sources of data, the study from years ago from Montgomery County, you know, increase in pregnancy rate in our school, which has to do with, among other things, lack of use of prophylactics. Again, we're not allowed to hand out contraception in our clinics, so, you know, on the one hand, they want to have us help with absenteeism, on the other hand, they tie our hands. No, but even, I mean, some of the, so I don't want to go into the reasons, but that's what we're centering on now. So our success, we're finally collaborating with the administration. That's our biggest success.
Yay! And it's a real big success to
it is.
And incorporate their priorities into your priorities, and although they don't seem to necessarily be in 100% direct alignment, that we can obviously work on linking the absenteeism and attendance with the social emotional health and with physical activity. And so you guys are doing a really great job, and I think it's I want to, you know, really just acknowledge all the hard work that all of the sites are doing, because it sounds like it's taken a lot of time to get those relationships up and going, and to maintain them is also a considerable amount of effort and energy, and that's definitely a wonderful success, and it's really great to see that like begin to be captured in the action plan. So thank you, Kay. Yeah.
So anyway, this is such a multifaceted problem. It can, you know, you can hit it from so many angles. It should be interesting. It should be interesting. So we'll see what we can get at that meeting on the 25th from other folks. We continue to dig for all the underlying could lead to the problem. So that's, I mean, that's all, unless you want me to go into more detail, and that would just probably bore people.
Oh, for Christ's sake, meeting will be over.
Huh?
No, that's great. It's also the one other win that Kay hasn't mentioned that's kind of a part of that is the fact that the principal has decided to designate an administrative liaison to the work that's happening at the SBHC, and in conjunction with Hallways to Health. So it ensures ongoing continued support. And although Montgomery County, Maryland has had some snow that's pushed back some.
And it closes, and my favorite part is that it closed one day because they predicted snow, even though the snow didn't start until the end of the school day. So that was, yes, we were closed for a whole week for snow. Anyway.
Yeah, but that you're continuing to make sure that happens. So that's awesome. Does anyone else want to share a success or a challenge from completing the Student Wellness Action Plan? Anyone from Milwaukee? I know that we talked a little bit about some components of your action plan. I'd love you to
Oh, okay.
Sorry about that. Everyone's so yeah. If Rachel and Christine, if you guys want to share out, I have your action plan as well. If you just want to explain first, kind of a little bit about your priority areas and how you use those to determine your approaches, and the evaluation indicators that you came up with as well.
Yeah, sure. So I think first and foremost, our action plan was informed by the Oregon Healthy Teen Survey, which is a needs assessment that is implemented for 8th graders and 11th graders every other year. And because we were not able to administer the RAPs, this was a pre-existing statewide survey that we use to inform the action plan. It again gets administered to 8th graders and 11th graders. So there's sort of two priority area issues or priority areas. One is addressing hunger and access to affordable and nutritious food for students. Again, this is determined by the Oregon Healthy Teen Survey, and we sort of came up with 3 separate approaches based on the action plan, the clinical, primary, and systems approach. And all 3 of those approaches were designed to work towards a couple different outcomes. Those outcomes are to decrease the prevalence of hunger by the next Oregon Healthy Teen Survey. Just as a quick background, the question on the Oregon Healthy Teen Survey asks about whether or not you didn't eat at all, or whether or not you ate less than you thought you should because there wasn't enough money to buy food. And then it also asks a question about how often you eat breakfast and have access to breakfast. So the first outcome is to decrease the prevalence of hunger by the next Oregon Healthy Teen Survey. The second is to increase access to affordable and nutritious food throughout the school. And then the third is to increase school-wide food literacy programs. So those are sort of the outcomes that informed all of our approaches. The clinical approach, Christine's going to quickly talk about, but the clinical approach focuses on our food screening process.
So we were approached by the Oregon Food Bank last school year to implement a brand new food insecurity screening. It's just 2 questions, and one of them is what Rachel said. Do you feel like you had enough food to eat? And do you feel, or have you eaten as much as you thought you should have? So with that, our medical providers use ICD-10 codes to note that they performed the screening, and then there is a positive food insecurity screen. And from that, students are referred to our behavioral health provider, and she will either connect them or help them connect with resources like getting SNAP benefits or accessing our food pantry at the community center that we have nearby, or create like a case management plan where the students will get ongoing support from the behavioral health counselor. And this is actually turning into an incentive measure through the Oregon Health Plan. So Medicaid is going to start paying for these food insecurity screenings next year. So usually it's really, hugely important that we do it, but we're actually getting incentivized for doing it too.
And so that's our clinical approach, right? And one of the things that we have noticed and are working towards is the sort of evaluation piece of that and implementing, and essentially, so the evaluation for that is collecting quantitative data around food insecurity. So right now we're working to figure out a process for collecting that data, and that's sort of the action piece associated with this approach. The primary prevention piece is about identifying sort of community partners in order to increase participation in a pre-existing program. We have a harvest share here at the school. So working with identified community partners about increasing sort of availability of affordable and nutritious food. And that's, involving all types of people. Myself, the Youth Advisory Council, other different sort of district-wide and community-wide partners. And then the systems approach is kind of touching on what I just said about the food insecurity piece being implemented at a district and a county level. So currently we're one of the only school-based health centers using this food screening. So essentially moving that beyond our school-based health center to all school-based health centers in this district, and then for Clackamas County to also use the use this food screening. And the second piece for the systems approach is to develop a referral process. Our thought process here is that in addition to people needing to be identified as experiencing food insecurity, they need to have sort of a process for where to get services in a coordinated way. And that's another way to involve other stakeholders. So whether it be a school social worker, school admin, teachers, community partners. That is the systems approach. And then the second key finding is related to social and emotional health. And I think you guys can see it right there, but it's addressing mental health needs of students, including self-harm, sadness, and anxiety. And this was, again, informed by the Oregon Healthy Teen Survey, which found that 20% of students surveyed had thoughts of suicide, which is very high and alarming to a lot of folks in the field and just in general. And then in addition to that, some other statistics that we found out about, high absenteeism because of a social or emotional issue, and just overall feelings of anxiety and sort of sadness has been sort of a high need. Not only that was reflected in the Oregon Healthy Teen Survey, but also just in our day-to-day clinical interactions, right, with students. And then we have the same thing, for this action plan, the three approaches, clinical, primary, and systems. The clinical intervention here that you see is something already happening, but I felt it was necessary to include because one, it needs to be built on, and two, I think it's worth sharing and talking about sort of that process for us. So it's implementing essentially integrated behavioral health into our school-based health center. We can go into a little bit more detail of that if you guys want, or we can sort of move on to the next piece under the primary prevention. What would you prefer?
Christine and Rachel, I would say that you've given us a lot to chew on, and so not only have you talked about like the process of using Oregon Healthy Teen Survey to inform the action plan, but I think that this has provided a really good example to the level of detail at which this action plan can be fleshed out and how it can be helpful in in following through with your priorities as you identify them. And then also, I appreciate you talking about the clinical interventions, some of which are already existing. So what I would suggest is maybe if there are any specific questions that other sites might have about something that you already talked about, that we could use a few minutes for that. Otherwise, maybe we'll leave off the third approach and the systems change and the primary prevention approach for addressing the mental health needs, and we can revisit those another time. How does that sound?
Good. Yeah, sounds
So
perfect.
what questions do you guys have? I know that, for instance, something like a 2-question screening at your clinic on food insecurity and the ability to code for it, as discussed in the first aim. Sorry, first priority. I can't scroll up to the right place of it. It might be something that's really useful for other sites. So other sites, do you guys have any questions about the tool that Christine and Rachel talked about, or the ability to code for these types of things?
I would like it if they, this is Kay at Northwood, I would love it if they posted a tool, the codes on Basecamp, so they would be available for the rest of us.
Yeah, that would be great.
We'd be happy to, and I can also give you the ICD-10 codes that we're using.
Yeah, that's yeah. That would be so helpful, so I don't have to thumb through that big old book.
Yeah, it's a nightmare.
One of our colleagues has it under his computer as a like a book rest. Yeah. So we definitely understand that. But yeah, that would be great. Does anyone else have any questions about either those approaches, or about how Rachel and Christine used this template to kind of really have a very detailed plan for what they want to achieve and how they're going to measure it? Are there any questions that they can answer about that?
This is Gabby, Diego.
Yeah, Gabby.
It would be really nice to just like the other participant had mentioned, if they could share, some of that and some details as how to collect and get that information and questions. That would be awesome.
Are you talking just about the food insecurity piece, or
yeah,
are you talking about anything else in related to development of the action plan?
Like details and the questions and how they did it,
Yeah,
that'll be great.
We can also put like a mini workflow about how we got buy-in from our medical providers, because that was the hardest part.
Yeah.
Okay, wonderful. That would be totally awesome.
Yeah, that would be great. Okay, great. Does anyone else have successes they want to share about either the environmental scan piece or the student wellness action plan piece? Or challenges or questions that you have to the group? Oh, you know what? I'm sorry. Some people were muted, so everyone is unmuted now, and I will ask my same question again. Does anyone have any other successes or challenges about the environmental scan or about the student wellness action plan as a whole?
This is Pat from St. Francis. I think that it's important to keep in mind that these are concepts and ideas and plans, and sometimes it's a long process, and they're not necessarily a challenge or not necessarily a success. But I mean, for example, with the healthier food, in the first couple years, I thought this was a big success, that I stopped the office staff from having them send the students to the corner store to get them wings and things like that. So it's been an ongoing process, and I think for many of these things, it's never going to be anything that's concrete or in stone, but it's really kind of fluid, as it should be, because, for those of us that are practitioners, we know that things change and emphasis change. So I think that helps people from being too discouraged.
Absolutely, yeah, no, thank you for that, Pat. And I think it wasn't necessarily talking about healthy eating, active living, successes and challenges. I was kind of more talking about you guys have had a lot of deliverables due. You know, the fall we spent a lot of time on the training piece of the program, and now we're moving into a lot more of the technical assistance piece of it. And this is the first time that I've worked with you guys to develop these, you know, task with developing an action plan. And I know it's something that you have done in the past, but I just kind of wanted to talk about that process, and if there's anything about that process that you know, so Kay at Northwood mentioned getting their administrators to sit down and have a meeting with them was a huge success and integral to what will be their student wellness action plan. And Rachel and Christine at Milwaukee just mentioned that it was that getting the medical sponsor to buy into using the ICD-10 code for the food insecurity screening was a huge part of the process that's involved in this, and that we can celebrate little wins along the way. Thank you for that clarification.
Absolutely.
Any other sites that haven't had the opportunity to share so far want to share anything that they've learned thus far in the environmental scan or while completing their student wellness action plans?
I just want to say I've met a whole lot of people.
That's great.
I'm actually an introvert, and so it's really pushed me to meet people outside the school.
Awesome.
So I think the training has been great from the APHA, and has taught me to think in a kind of a different way than I was thinking. I was pretty good at setting up. We now have some people from the Wellness Center actually in the classrooms helping some of the people from other countries adjust to this country. So we've gone that far. So it's not specifically on nutrition and that kind of wellness, but social emotional wellness. Making the transition. A lot of these kids are reuniting with their parents for the first time in a decade, getting used to a new culture, and for the administration and ESOL teachers to invite people from wellness into the to talk about big steps. So,
yeah, we love to hear those continued stories, and that's great. And that's another really wonderful strategy. I know that many of you have addressed students who are immigrants and trying to think about how to, in your action plans, that if there's an attendance or graduation rate that's specific around immigrant students, that might be a potential area for an approach as well, and showing greater school integration with the ESL classes or ELL classes is a really fabulous way to improve social emotional health. So yeah, so we'll look forward to seeing and hearing more about that. Okay. Okay. So that concludes that piece of it. I just want to move on quickly to some project updates. So thank you to all of you guys for submitting your first and second quarterly report. I know that asked a lot of questions about the needs assessment. That has been an ongoing process, and I just want to say that full sentences are preferable. More detail is appreciated, and if there is something specific that you need technical assistance on, or want to see changed, or need to note, please indicate it clearly. We're not mind readers, so it's a little bit hard to interact with that document in a way that is we want it to be the most helpful to you to moving between your action plan and being able to achieve those evaluation indicators at the policy and system change level, and we want to be able to provide the most assistance that we can in doing that. Some of the next reporting template will look the same because some needs assessments were still in process. So it'll be the same to accommodate that, and then there will be some different components that I'll ask about. How much progress have you made? Are you on track? What are your immediate next steps to, just as we mentioned, help incrementally move you from the idea of the action plan to getting closer to policy change. So we will be posting that template soon, okay? And the calendar for the first grant year has been posted to Basecamp. And you'll note that that calendar has the deadlines for the invoices as well as the deadlines for the reporting, as well as outlines some programmatic work, and has all of the dates for the rest of the year for our Learning Collaborative calls. And obviously, we had great attendance on today's call, and that should keep up, if not increase. And your health educator should definitely be on the call. In some cases, if you want to invite other participants into the call to share out some successes, that would be great. And the state leads are on as well. So you can let me know if you have any questions about that. And if you have any unmet deliverables at this point in time, or things that need to be updated, for instance, if you guys had low school employee wellness survey participation and you have an update, or you've modified something in your school employee action plan, just please be in touch with me and complete any unmet deliverables ASAP. Okay, and just on the communication piece, we want to be able to share out your successes, your wins, your stories, your anecdotes, the tools that you have found to be useful, articles that are interesting, questions. I've begun to use Basecamp to post articles and interesting webinars. I encourage you to do the same. I know that those of you that are clinicians may not be able to, to use the Basecamp platform as an ongoing opportunity for cross-collaboration, for answering questions, and for sharing out stories and anecdotes, okay? And as we mentioned, 2 sites are interested in having the food screening tool, food insecurity tool, be posted, so that's a great way to utilize the platform. Does anyone have any questions about Basecamp?
Yeah, Jordana? Hello?
Yes.
Hi, it's Aurora from the San Fernando High School Health Center.
Hi, Aurora.
I was kind of confused. You mentioned that on Basecamp you posted on the calendar, but I'm looking at the calendar and my calendar is completely blank.
Sorry, yes. I have posted a calendar as a file.
Okay.
For year 1 grant reporting, but I will be posting the dates of all of the invoices and Learning Collaborative calls on the calendar as well.
Got it. I see it. Thank you.
Reminder. Thanks for the clarification. But I will be updating that in the next week, okay?
Okay, thank you.
Okay, great. Any other questions on Basecamp?
Yeah, I'm sorry, Jordana? I'm sorry, I came in late because of a patient emergency that I was finishing up. So I'm sorry if this has been answered. The slides that we saw here today will be posted. How?
I'll post the recording.
Okay, so I have to listen to the whole recording to look at the slides.
Oh, that's a good question. That's a good. I will post the slides and the recording.
Thank you, ma'am. Appreciate it.
Okay. No, I can't tell. Okay. Okay. And drum roll. I am so excited to be able to meet you guys in person over the next few weeks at our site visits. You should have all received a calendar invitation from your state affiliates, and you will be receiving preparation questions and materials next week. We are strongly encouraging you to invite your teachers, administrators, and other partners to participate in the meetings. And please let your state affiliates know if there's particular times during the visit for these introductions. We'll be sending a few questions for those folks to be able to answer as well, okay? And just to let you know what I'm hoping to achieve at those site visits, I'm hoping to build my relationships with each one of you to understand the environment in which your SBHC operates, and to be able to also provide additional technical assistance on the school employee wellness plans, on the student action plans, and anything else that's going on. So those are my goals, and I'm really, really looking forward to it. I think it's been a long year of working remotely, and I'm excited to share that with you. And I'm also excited to have Kara Ann, who's on our research team, be able to join me first for some of the site visits. If there's any teachers as well who can participate in the participate in parts of the meetings, feel free to invite them as well, okay? Does anyone have any questions about the site visits as a whole?
Excuse me, this is Pat, and I'm hoping that we are going to be back and totally up and running, but you know, we had this little crisis with one of the students charging a hoverboard in one of the classrooms, which caught on fire. Unfortunately, fortunately, no one was hurt. Unfortunately, the classroom was right above our clinic. When the system was activated, we got a bath, and they are continuing. We just got electricity back today, so since our site visits is done up to, yes, I tell you what, going to the bathroom without light is not exactly good. But anyway, hopefully we will be able to fall through as scheduled with that, but I will keep you posted.
Yeah, thank you so much. You guys are close by, so it's a little bit easier, but for the folks I'm headed to via plane, rescheduling might not be as simple, but if it needed to happen, it could happen. So thank you so much.
Right. Okay.
Any other questions about site visits? We're glad you're up and running and everyone's safe. Okay, last but not least, the March Learning Collaborative call will occur in the middle of my site visit roadshow on March 10th from 3 to 4:30 Eastern Time. And we will be focusing on introduction to policy change because we're talking about policies and system change for so much of as our goals for the project. We'll be talking a little bit about how policy change can occur, the types of policies that can be influenced, and we'll have in mind, the school-based health centers and whatnot. So please begin to consider your questions and examples for this call, for that upcoming call, and if you have any specific questions about, I want to change a policy at the district level, but I'm not really sure how to start, or we've tried to work on the nutrition of the school lunches with the food vendor a variety of times, but we've gotten shut down here, there. Any questions like those would be great to kind of send to us in advance so we can know how to best help and provide a little bit of training on that call. So that is actually it for me. I just want to allow for an opportunity for questions from you guys. Okay. So thank you so much for participating. And as I said, we will be posting the slides as well as the recording of this presentation. And I'll look forward to seeing you in a few weeks. We will be sending you the preparation for site visit materials, okay? Thank you, everyone.
Thank you.
Thank you. Bye.
Thanks.
Bye.
Thank you.
Thank you.